Good day, everyone. This afternoon, we will hold our classes in the discussion of our topics in the nursing informatics. If we will try to recall the topics that have been discussed during the prelim period, it is somehow that we may connect on the related topics that uh, will be considered in this period. And those basic learned concepts that you have acquired will be more relevant as well in our discussion for this afternoon. And when it comes to the learning outcomes, the learning outcomes of our topic for this afternoon is to discuss the different key areas of the nursing informatics. And another is to consider how nursing as a science and an art could be correlated with the knowledge. So this is on how nurses utilizes the acquired knowledge when it comes to the application of the technology in nursing informatics. In the prelim period, we have discussed the basic competencies that are deemed in demand when it comes to the needs of the healthcare industry in the national level and even in the global level. So we'll start with our discussion on the topics pertaining to the association and significant relationship of nursing and knowledge. It was emphasized in the nursing informatics that nurses are having this flexibility, and nurses are also easily trained to acquire the capacity to adjust towards innovations and technology driven initiatives of various organizations. And with this flexibility, nurses cannot just only consider themselves on the actual bedside care, but indeed, we can consider that nurses are innovative when it comes to the new technology that that can upgrade the standards of quality care management to our patients. So let us now proceed with the number one on the association of the nursing and the knowledge. With the number one, nurses are considered as knowledge workers. If we say knowledge workers, uh, with the formal education of nurses during the learn concepts in the various learning settings of classroom, skills laboratory, and even the actual performance of the performance of the acquired competencies or the expected competencies in the RLE clinical, the generation of information that had been reinforced from the lecture, from the validation in the performance in the skills laboratory through return demonstration, and the actual performance in the RL clinical has already been considered as a knowledge. So the knowledge that had been acquired by the nurses, okay, by the nurses. So the process that I have talked about is pertaining on how the student develop the competencies. And when the nurse uh, is already practicing or are already doing their professional practice, this is on how this uh, learned competencies of the skills, the knowledge, and attitude are being generated in a uh, more independent practice in the clinical setting, such as the bedside care. So they are considered as knowledge workers. Our key term for the knowledge workers is the use, okay, the basic use of the acquired knowledge, skills, and attitude. Knowledge may not just only be cognitive, because in the Bloom's taxonomy of learning, knowledge could be learned not just only on the thought process, but also when it comes to skills and when it comes to the performance with attitude. So this coincides and correlates with each other. So again, with the number one, nurses are considered as knowledge workers with acquired knowledge, skills, and attitude. Our key term is acquisition. Okay. Let us now proceed with number two, knowledge acquirers. Knowledge acquirers, from the term itself, acquired, so somehow related with the number one, knowledge workers. Knowledge workers with the number one, they become more effective because they have utilized what they have learned in a more independent practice. Okay? Knowledge acquirers tends to be more on the how the nurses becomes efficient. And that's the and it indicated here how to there rather how to be more convenient in capturing and in storing knowledge. Okay, so in the prelim period we have discussed the difference between data, information, knowledge, wisdom, then until it is utilized in the community. So when we talk about knowledge acquirers, the key term here is efficiency. Okay, when we talk about the efficiency, we maximize the available resources of the organization. Aside from the concern that we are having the processes, we have the technology. However, the resources are very important so that it could be more efficient to process these procedures of the organization or the healthcare establishment. So it provides convenience because when nurses are aware of the available resources, the needs of the organization and the clients can be attended, okay, because of the efficiency. So the efficiency is related on how the nurses maximize available resources. And what are those available resources? When we will correlate it with the nursing informatics, the available resources could be the manpower. Okay, the manpower, those persons who can help the nurses when it comes to the processing of data and efficiently store it for future use. Another is the equipment, okay, the equipment, the machines, okay, the M, the machines that are very significant when it comes to the storage of data. So the capacity of the and capability of these machines and equipments, such as the hardware, it could be also the software that may have the efficient capabilities and capacity to store uh, information. Another is, other than with the manpower, most probably we are also considering the budget allocation on how it could meet specifically the expected function on the use of the nursing informatics in the processes of the institution. Moreover, this could be used in a hospital. This could be more uh, visible, okay, when it comes and appreciated more in the hospital operations. So again, for number one, knowledge workers, our key term is more on the acquisition of knowledge, skills, and attitude. Knowledge acquirers is on how the nurse becomes more efficient in the use of or in maximizing the use of available resources. So let us now proceed on what are knowledge users. Knowledge users, individuals or group who benefit from valuable and viable knowledge. Okay. Our key term for knowledge users are valuable and viable. Okay, viable means that the knowledge that you're presenting, the knowledge that you are using are feasible, doable, manageable when it comes to the setup. Because we need to check first, primarily as nurses, that before we use such knowledge, is it possible to and feasible that the hospital or the establishment can sustain its operation. Okay, it is valuable because that's the already the output that the knowledge that you are considering could be more. What are those trees that we mentioned in the nursing informatics components? This could be more relevant. This could be more meaningful and useful. So that's the value. Okay, the viability is concerned on how it could be sustained. Okay, how it is on if it's doable in the setup, if it will fit with the needs of the industry or in the of the establishment, while it becomes valuable when the nurses as knowledge users translate it to a more useful, relevant information. Okay, so to have a review of the first three, knowledge workers are considering generating information. Our key term here is acquisition. Okay, the nurses acquired knowledge, skills, and attitude in the performance of independent practice. While in the knowledge acquirers, this is on how the nurse becomes more efficient, okay, in the storage of knowledge and information through the maximum use of available resources. And knowledge users, it is on how the nurse will utilize the knowledge that are doable, manageable, sustainable, and may lead to a product or an outcome that is more relevant, that is more meaningful, and that is more useful. So it will be beneficial for the individuals or the groups. So the first three are clear. So let us now proceed with the next slide. Knowledge engineers. Okay. Knowledge engineers, from the term, we are aware that engineers on a technical aspect may need more, okay, more expected skills when it comes to structures, when it comes to technical details of plans. However, on the level of nursing and knowledge, we considered knowledge engineers as designing, developing, implementing, and maintaining knowledge. This is somehow a more holistic. Yeah, and that's what we could say here. Knowledge engineers could be more holistic because and innovative, holistic and innovative, because the nurses as knowledge engineers could be involved in the planning and implementation as well. So both planning, implementation, and evaluation of the processes using the technology. Just like, for example, um, in the use of the hospital information system, if there are some concerns that may need troubleshooting, or if there are some concerns that may need referral, the nurse can independently, okay, independently process troubleshooting by his or her own. Although it may need other manpower or specialists in the hospital, but nurses with his or her training as well and confidence, he can easily attend to such troubleshooting. And other than, as what I have mentioned, nurses could be involved in the planning. When there will be a proposal on the processes of the hospital information system, it is best that nurses could be considered as knowledge engineers because the nurses will contribute to the input, to the input on how nurses will need the certain features or will consider certain features of the hospital information system, which is very important for the storage and protection of the client's data and information. So again, when it comes to the knowledge engineers, nurses could be more innovative and will be involved in the planning, in organizing, implementing, and even monitoring of the internal processes. Okay, so number five, how about knowledge managers? Nurses being involved in nursing informatics may consider as individuals, okay, individuals that will not just only benefit uh, uh, certain profession, but it may also benefit all the professions, employees, clients, and the whole organization as well. So knowledge managers may discharge the what we call the collaborative, okay, the collaborative role when it comes to knowledge managers. Uh, when it comes to the first discussion on how the nurse becomes uh, efficient as knowledge acquirers, the difference with knowledge managers is it will focus now on the collective expertise. So what do you mean by expertise? This is a higher level of efficiency. This will utilize the collective efforts and decision making of the available manpower of the hospital. For example, to have a more to have a more comprehensive implementation of the hospital information system, we may involve the medical department, specifically with the doctors, because we have the medical informatics. If there will be implementation of the telemedicine for nurses, moreover, because of the bedside care management for the clients when it comes to the processing of the needed documents and for the admission and billing processes, and specifically the other employees who are involved in the departments when it comes to the central supply, when it comes to the inventory, when it comes to other services. So so that the processes will be connected with each other, and the connection that we are talking about as knowledge managers are specifically on the collective decision making, a collaborative function of nurses as knowledge managers. Okay, so number six is all about the knowledge developers or generators. The knowledge developers or generators are concerning to nurses, which may consider the term here is evolving knowledge. Kasi knowledge developers or generators, if we say, what's the difference between knowledge engineers and knowledge developers? Knowledge engineers, nurses will be involved in the planning, organizing, implementing, and evaluating. While knowledge developers or generators, nurses may use knowledge to become visionary. Okay, they may think of the future. So that's why situations like uh, nurses can be considered as catalysts of change. And to be catalyst of change, you must be visionary because there is evolution of knowledge. Eh. So knowledge developers or generators, the nurse role here is to upgrade the skills and knowledge through opening himself or themselves accordingly to some of the updates, some of the trends, new trends that could promote efficiency and effectiveness of the service operations of the healthcare establishment or facility. So again, let's start, let us have the 4 to 6 summary. If we say knowledge engineers, okay, nurses will be more innovative. Okay, innovative when it comes to the involvement in the processes of planning, organizing, implementing, and evaluating of the knowledge of the developed system of the hospital. While knowledge managers, the role are more on the collaborative and collective decision making, while knowledge developers or generators, it may consider the visionary role, thinking of the future and evolve knowledge to translate knowledge into the trends that may help the organization to have more efficient operations. Okay, so this is now the what we call nursing informatics model. When it comes to the nursing informatics model, it is very important for us that we will now integrate what we have learned from the concepts and components of nursing informatics. In the nursing informatics model, it will show to you now how the healthcare system involving nurses will integrate it into the various areas and specialization of practice, and on how these areas of specialization and practice will utilize the basic concepts of nursing informatics. So let's discuss it one by one. When we talk about healthcare system, healthcare system could not just only be in a hospital setting. It could be on a community level. It could be other healthcare industry. It could be national, just like here in the Philippines with the Department of Health. It could be global, okay, global, because we have the Center for Disease, Center for Disease, Center for Disease Development, or Center for Disease Development. So we have the World Health Organization, which is basically global. So that's the healthcare system that we are talking about. So on the community level, on the local, national level, we have the Department of Health, and the global level who seems to attend the healthcare of the the various countries, settings worldwide or globally. So there are many settings and areas of specialization where nursing informatics are integrated, such as education, practice, research, and administration. When it comes to the nursing informatics model, when we are aware, even us as professors, we need to be more knowledgeable and be updated on what is going on with the uh, structure of the use of technology when it comes to the processing or involvement of nurses in the healthcare system. Just like, for example, a typical example in the healthcare system is the universal healthcare. In the universal healthcare, it may involve the processing of pill health. In the universal healthcare, it may involve processing of data and information of the nurses, of the health professionals, and the patient census. In universal healthcare, it may facilitate how to access the services through the use of various uh, platforms that are open by the national level of the Department of Health. So if we are immersed in this, that's why nursing informatics had been integrated in the BSN curriculum, so that it will open doors and opportunities for all of you to know that in the education sector, we are the ones who will prepare you to open venue for all of you to appreciate the importance of nursing informatics in the healthcare system. So that's why we are not just only talking about the use of computer, the use of gadgets, the use of applications. It is on how and on why these innovations are continuously evolving. Simply because the needs and demands of the healthcare industry also are taken into consideration. Because just like today in the public health emergency, we have certain limitations. Limitations by which in the education sector, we cannot do the face-to-face meeting due to the specific guidelines that are implemented by the government. So how the higher education institution will adjust to it. The continuation of the services and the responsibilities of the education sector is to continue what is being expected that the student must acquire. So just like in the nursing informatics, we will use we will use the expected competencies, we will use resources, we will use systems and procedures on how the students will acquire such expected knowledge, skills, and attitude. So in education, it could be connected to the healthcare system because we're already introducing to you on what are the present and existing setting of the implementation on the use of technology-driven initiatives by the local, the national, and the global. Next, when it comes to the practice, so once you have already earned the BSN degree and has the license already and claim it, that you are already registered nurses, this will continue your development when it comes to independent practice. Because in education, okay, in education, you are partially independent. Why partially independent? Because you are still under the supervision of the clinical instructors or your course facilitators. While in the practice, you could be supervised by your head nurse, but more you will discharge performance of responsibilities independently. So higher level of independence and clinical decision making. So what is the importance of the nursing informatics? So we will try to connect it with the healthcare system because you are now part of the healthcare system as manpower. And when it comes to the practice, you need to embrace what are the systems and procedures that the workplace, okay, that the work setting is implementing. And through these technology-driven initiatives, it must be it must be considered the orientation or your orientation, and obviously it will be part of your responsibilities on these internal processes. So the generation of data, information, knowledge to wisdom, and how the establishment and the community will benefit it will be now your responsibility independently. So you need to be more oriented, okay? You need to be more updated. So that's why continuing professional education is advisable at this level. Next is we have other areas of nursing that could correlate in the nursing informatics is research. Okay, when you are about to be nurse managers, okay, nurses with administrative functions, then we could uh, consider that problems that may arise in a certain unit of the hospital could be resolved by your level, although it's with the collaboration with your subordinates, but the expected competencies at your level is to look for solutions already and present to your colleagues and subordinates. So that's why, for example, when it comes to the data protection of your clients, and when it comes to the generation and storage of the client's information, research could be a way, okay, could be the best way to acquire a solution through its conclusions and recommendations. So how it will improve the healthcare system? Your involvement as nurse with administrative function may present solutions to have more efficient and effective uh, implementation of service quality, okay, or quality service of the institution. That's which could be measured, which could be measured by the satisfaction of the clients, and which could be measured on the uh, increase uh, uh, census of recovery as well as admissions, because the trust of the stakeholders are already in place. So the research could also be a way where which we could connect and we could upgrade the services accordingly that is aligned with the demands and needs of the healthcare industry, which that's why in research the the use of hospital information system, once you've heard it, wow, it's uh uh, a hospital, a premier hospital that promotes excellence because they are already open up and embrace the technology to become more efficient and effective. And that is the result and the outcomes of conclusion recommendation of research. So it improved the healthcare system as well. So that's why with our limitation nowadays, telemedicine are being implemented accordingly because of the limitations of the physical consultations in the clinics. So these recommendations could upgrade the healthcare system and may promote the establishment as well. Next, when it comes to the administration, okay, the administration talks on the how the concept of management and leadership can be used accordingly. Okay, can be used accordingly when it comes to the healthcare system. So this is more organizational. So education is on how you will be prepared as nurses with the acquired or with the expected competencies. In the practice, the higher independence of your decision making, okay, could be identified to the continuing professional education. In research, you are expected to provide solutions that may improve the efficiency of the healthcare system, while in the administration, it's more organizational that will highlight the existence of the hospital in the community. So this is now a more broad has a more or has a broad scope. What is the broad scope of it? Because the administration may not just only consider the existence of the hospital, but the role and the existence of the hospital that may benefit the population groups in the community. So it is not just on the level of the services that is focused on the curative and rehabilitative. But when it comes to the administration, the use of the nursing informatics model could be beneficial on those that are not only sick individuals but also well individuals in the promotive and preventive care. The hospital may have the use or may use the nursing informatics to improve the healthcare system in coordination with the community health centers or with the city health offices so that it will be more collaborative to improve the healthcare system of the community. In such, in the nursing informatics model, it will integrate the use of the computer and information science. So your knowledge, nursing science, then this combined with the computer and information science. So the information science that we are talking about is how you will design, develop, store, process information through the use of the technology. That's why on the bottom portion of the nursing informatics model, it it will consider how data will be translated into knowledge. So from the data, it will be processed accordingly into the information that will be more useful, and it could be more meaningful if this information could be transformed into knowledge. So the process itself could be very, or we will go back again to the three areas or the objectives of the components of nursing informatics. It is more relevant, okay, more useful and meaningful. So as long as this knowledge are being used, then this will benefit as well as the stakeholders, because eventually, for example, if the information has been translated into knowledge, the nurse can easily uh, process information because she has been oriented. She is an experienced nurse. She can be she can quickly and immediately address solutions as well if the data has been translated into knowledge. So this is the nursing informatics model. So as we continue with the next, our next is all about the 5 key specialty areas. So probably it will be the part 2 of my video presentation when it comes to the nursing informatics model. So please watch the second part of the video. Thank you very much.